Welcome, everybody, to our National Wellness Action Alliance webinar series. And I'm so delighted to have with us today Dr. Alyson Hanish. Alyson was recently awarded a HRSA grant. So congratulations, Alyson. She is an assistant professor at the University of Nebraska Medical Center School of Nursing. Alyson, we're delighted to have you with us today to talk about collaborative investment in nurses at Nebraska, resiliency, retention, and well-being.
Wonderful. Thank you very much for that introduction. Let me share my screen here quick. Well, thank you again for having me today. And I'm here to present the Nebraska Collaborative Investment in Nurses, Resiliency, Retention, and Well-being. There we go. First, a little bit about me. We had a great introduction, but I want to give you a little bit more background. I am a pediatric nurse. I did my BSN and PhD at the BSN to PhD program at the University of Iowa. So go Hawks. I did a predoctoral fellowship at the National Institute of Nursing Research through their graduate partnerships program. So I did intramural training there. So my dissertation was done in Bethesda, working largely with pediatric endocrinologists, working with very rare pediatric genetic disorders. And this was funded by the National Institute of Nursing Research. One of these genetic disorders, these kids were missing or had hypoplastic or very small pineal glands or glands in their brain that produce melatonin that help you sleep. So I say I was born a pediatric sleep researcher at NIH, a combination between the research, the kids that I was working with on my dissertation, but also these three little kids at the bottom are mine who had various degrees of sleep problems throughout their life. So I love pediatric research, very, very into pediatric sleep. I did a couple years of postdocs at the University of Nebraska Medical Center, as well as the Monroe Meyer Institute for Genetics and Rehabilitation. This is our center on campus that largely works with kids with neurodevelopmental disorders. Both of these experiences, I learned the huge importance of transdisciplinary teams and working in teams for research to move important projects forward. And they really set me up well, this training, to be able to take on something like this HRSA that I'm going to present today. As Bryn said, I'm an assistant professor at UNMC. I'm currently a K01 awardee through the National Institute of Nursing Research. I'm working on a pediatric sleep clinical trial that we just have wrapped up. And then also a HRSA awardee, which is what I'm going to be presenting here today. Okay, so the disclaimer statement that I need from HRSA is the project is supported by HRSA and the Department of Health and Human Services. The title of the grant, the funding, the information presented today and its contents are those of me, not construed to be construed with official position or policy or endorsement of the HHS or the U.S. government. So HRSA, a little bit of a background about how this grant got started. So like many of you out there, this pandemic and the transitions involved have been a very, very big part of my life. My husband has been working COVID the majority of the pandemic as a physical therapist. Obviously, me at a College of Nursing, the impacts were great. We live in a neighborhood that is very, very close to the university that has our major medical center, our only state hospital here. And so our neighbors, our children's friends, everyone around us really was involved in the healthcare in some part that was impacted by this pandemic. And it really strained a lot of relationships and a lot of people. And I saw that firsthand. And I saw this HHS announcement come out where the Biden administration was releasing $103 million from the American Rescue Plan to strengthen resiliency and address burnout in the healthcare workforce. And at the time, I reached out to our dean and our associate deans, and I was like, is there somebody out there who's interested in this? Because I'd love to be a part of it. But like many health professions out there right now, everyone was very, very busy. We have a lot to do, a lot of work to be done. And at the time, it just wasn't seeming to be a good fit for somebody to lead this sort of initiative. And so that kind of fizzled out for a second, but I just couldn't leave it. And something about it, I just couldn't stop. So I kept looking into the research. Again, I'm a pediatric sleep researcher. This wellness is part of that. Obviously, sleep is very important, but it was not my primary area. I'll say that. But I just kept reading. I kept reading and reading. And we know as nurses these issues, but I had not spent the time really researching what was out there. In terms of the nursing shortages, the recruitment and retention issues that we're facing, burnout, mental health, substance use disorders that many of you on this panel know a lot about, and how COVID really exacerbated some of these underlying issues that I know we've always had, but have become worse over the pandemic. And the media portrayal of nurses and frankly, healthcare professionals in general is something I paid close attention to. I just remember seeing the healthcare heroes portrayal out there. And even my husband would come home with a superhero pin that he was supposed to put on his scrubs. And then it kind of changed into this faces of these bruised and battered healthcare workers. And over time, that media portrayal has stayed sort of negative. And so all of these things in combination started making me want to look further into this area. And I just thought to myself, we must invest in the health of nurses. We need to do more. And as I kept reading, and as many of you on this webinar know, burnout and mental health conditions, they're multidimensional. They really need individual as well as system level action. And what I was finding in the literature is there was this need to really focus on nurse wellness over the continuum. So not just on students, not just on the early career practicing nurses, even though we know that there's huge dropout rates there, all the way to the end of nurses who've been working for 20, 30 years in their career. We needed this more continuum of wellness. We really needed innovative, evidence-based resiliency programs and ways to deliver those programs. And that's what the HRSA was focused on. I use the term resiliency here. A lot of the times I'm going to be replacing it with wellness. Resiliency was the term used by HRSA in this grant call. And although a part of our programs, most definitely, and an outcome measure of our programs, they are more wellness, whole wellness focused. And as I kept going and thinking about how this could be implemented, how we could do wellness, it became very apparent to me that we needed a statewide collaborative investment in nurses. The way UNMC is set up, there are 5 different campuses. Omaha, where I'm at, which houses our state medical center, Nebraska Medicine, as well as our Lincoln campus of the University of Nebraska. And we have 3 other campuses, Scottsbluff, Norfolk, and Kearney, all across the state. So our nursing programs span the entire state of Nebraska, and we needed a statewide collaborative to move these sort of interventions forward. So how this came about is I just couldn't leave it. And I remember trying to talk to everybody on this list of who would be a good fit to run this. And given everyone's time and other commitments and a very, very enthusiastic support from my dean, we all decided that I would put in as project director for this grant. And I say that I'm not by far the wellness expert on this team, but I have huge passion for the health and wellness of nurses. And I have a huge passion for bringing people together who may not always talk to each other in a way that can be collaborative, that we can all work together towards that. Again, my training at NIH and my training working with kids with neurodevelopmental disorders and the huge amount of transdisciplinary teamwork that needs to be happening with those kids kind of set me up in a great position to take this on as project director. So on this list, we have nurses, we have advanced practice nurses, we have psychiatrists and psychologists, we have our director of wellness programming. We have a huge investment from the College of Public Health, who is integral to our success. We also have partnerships established with the Nebraska Board of Nursing, Nebraska Center for Nursing, which houses a lot of our workforce data related outcomes, and the Nebraska Hospital Association. So our team now is over 20 people, and we're all working together towards a common goal of investing in the health of nurses across the state of Nebraska. So this is a 3-year grant that we received from HRSA, and the overall purpose of this Nebraska collaborative investment is to deliver wellness-based interventions and resources to address and reduce burnout and mental health conditions in those particularly working in rural and medically underserved areas. This HRSA call was actually specifically for rural and medically underserved areas as one of the target areas they were working for. And Nebraska is obviously a state where we have a substantial amount of rural and medically underserved populations. So those are our focuses, and across all of our 5 campuses, we do hit on that area. In terms of the people in this grant, we have, we're targeting undergraduate students, graduate nursing students, as well as those practicing registered nurses and advanced practice registered nurses. So we're trying to hit the entire continuum of students all the way through those practicing. In terms of the HRSA, again, it's over 3 years. There's 4 different aims, and I could probably spend an hour talking about each of these aims. So I'm going to give you a higher level snapshot of what they look like, and I would be happy to take questions at the end of this presentation or via email at a later time to discuss further. Our first aim is really focused on implementing and evaluating these resiliency or wellness-based interventions, utilizing this whole program. WHOLE stands for wellness, how one lives effectively. Using these programs in our undergraduate nursing students, again, focusing on the rural and medically underserved areas. In very brief, this whole program, this whole wellness program, was developed at UNMC by our psychologists and psychiatrists that are actually on our team working for us. It's designed as an 8-week course to teach participants skills to enhance their personal wellness and reduce the harmful effects of chronic stress. We touch on things like meditation, mindfulness. We explore the value of gratitude and humor and creativity. We do hit on exercise and, of course, sleep. I couldn't leave sleep out of that. And we also do things that are more psychotherapeutic strategies to identify dysfunctional patterns of thinking and responding to those thoughts and teaching ways to counteract that and to change patterns to be more positive and beneficial. So again, it's an 8-week program. The beauty of this grant is it allowed about a 6-month period for us to start developing it. This whole program had been piloted in medical students and nursing students at a very small scale before and had very positive feedback when it was implemented as a pilot. But we've spent the last 6 months really refining it and getting ready to launch it. Our plan is to launch it this summer with our undergraduate nursing students across all 5 of our university campuses. And how it's set up is that it's an 8-week program, and the students will start it the summer before they start nursing school. We have a program called Nursing 101 right now, which is an optional course that students can take. It's had about a 90% participation rate so far over the past couple of years. And we're going to embed this wellness program into that Nursing 101. Again, it will be 8 weeks before they start nursing school. Our psychologists and psychiatrists on this grant are going to deliver about 1-hour sessions of this whole program over 8 weeks. We're also going to have about 4 different, we're calling skills groups, where we're going to have groups of 15 or so students into these skills groups, where they're going to further talk about what they've learned in the wellness programs, have assigned activities that are more active learning. They get experiences to be able to meet others in the program and to talk about wellness interventions as small groups together. One of the beauties of this HRSA is we allow for this rapid cycle quality improvement. This is going to be our first year launching it, but we have 2 additional years to seek feedback from students, from faculty, from facilitators, and see how we can improve for the future. So really excited to start launching that this summer, again, for all of our undergraduate nursing students across all 5 campuses in the state of Nebraska. One of the other awesome things about this is I was able to talk to people like our colleagues in the academic success department and really start to see what kind of resources would you need to do your job to the best of your abilities. And some of our academic success coaches said that it would be super beneficial to have a software platform where they could house all of the student information. And by that, I mean the students in the program, their contact information, maybe their accommodations that might be needed, what wellness resources have they been provided, if they sought help for some sort of intervention, say they needed tutoring or time management skills or mental health referrals. that this could all be housed in a software platform. We currently don't have that at our UNMC in Omaha, in Lincoln. Some of the other campuses do have some versions of this, but we were able to purchase that and work with our IT department and our university as a whole, actually, is what we've learned over the last couple of weeks. And we're going to be one of the pilot programs here to start this off. So to purchase a software program, be able to have a comprehensive snapshot of the student success services that we can provide to students, and then track that throughout their time in the program. So this grant also gave us resources that we may not have, maybe we would have had in the future, but it's sped that process up a little bit. Our second aim is to develop, implement, and evaluate these train the trainer models. So what we're hoping is that our wellness programs can be spread out throughout the state, beyond just the UNMC university system to other systems. And one way we thought we could do this was to use our psychiatric mental health nurse practitioner students. And we actually have them in the summer coming to these train the trainer programs to learn about our wellness program and then to be future facilitators in these wellness programs across the state. We also know that we need strategies to address our shortages of behavioral and mental health nurses, and frankly, all behavioral health providers across the state. We are in a dire need of more. One way we're going to start doing this is we're going to be hosting annually these conferences or summits, I would say, that are funded by the HRSA. This one's the first one we're going to be having is in September, and it's called Heal the Healers. And we're actually going to be having some fabulous speakers talking about the ethics of wellness and why we have an ethical obligation, in a sense, to take care of ourselves to be able to take care of others. So that's aim 2 that we're working on. The last aim, this one's so exciting. We are working with the College of Public Health at UNMC. We are looking to design, implement, and evaluate psychological first aid. And for those who don't know what this is a program that we are currently using through Johns Hopkins, and they really, it's how you can help others. In terms of a psychological first aid. It's set up, and it's actually free and publicly available on Coursera to take. It largely focuses on natural disasters, and the examples they give are fires or storms of some sort, and how you take care of others at those crucial moments of need. And as we watched it, it's made for more of a non-healthcare provider lens, but we found it very, very helpful. And the College of Public Health has started to use that in some of their campaigns in terms of psychological first aid. So we're going to be using these echo models. And this is the College of Public Health brought this to us. And it's a very, they can more eloquently explain it than me, but essentially it allows you to deliver the content virtually, and they use an all teach and all learn philosophy to engage the learners. We'll have activities, it'll be interactive, we'll be able to have conversations about what they learned in these psychological first aid courses, and have small groups of people be able to come together to talk about that. We're going to do the same thing with our whole wellness, our wellness programs. We're going to deliver them via these echo models. Again, these are virtual. They can be used across the state as platforms to deliver our wellness interventions. The psychological first aid is focused on how you can help others, while as the wellness program is developed on how we can help you. They will be offered for no cost continuing education credit. So again, they can attend. We will provide continuing education offerings for free. One thing we're really focused on with this is accessing our rural medically underserved areas. So how we have it written in the grant is we're allowed to pay critical access hospitals across the state to then help recruit essentially nurses to participate in these programs. We're not allowed to directly pay nurses, but one thing I was very adamant on is I did not want to add something else onto their plate when we know nurses have a lot going on already. So we're able to pay the hospitals, who essentially then can provide the time for the nurses to complete these wellness trainings. And then the last aim, we actually haven't started yet. This one's supposed to start in summer of this coming summer. And when I put in the grant, I really wanted to, I didn't want to put it in unless we could help the people who are actually at the point of crisis. And so what we have done is worked with the Nebraska Board of Nursing to see what programs are out there right now, particularly in our critical access hospitals across the state, to help people at moments of crisis, to help the nurses when these things are actually happening. In the past, they'd had these critical incident stress management models or these critical incident management debriefings set up, and it had been funded through state, essentially drug money. So it was kind of a variable amount of stream of money that was going into these programs, and they weren't effectively being implemented, to say it nicely. So what we've worked with the State Board of Nursing to start this summer. We're going to pilot programs to set these teams up. One of the issues is in our critical access hospitals, often the people who are involved in the crisis are the ones who would be tasked with providing the management and the debriefing. And that's obviously not a very good setup. So we're hoping to set up regional centers that can then affiliate with across the state and the needs that people have at that time. These teams will not just be nurses, they will be the kind of professions that are in the critical access hospital. So they're the EMS, social workers, nursing assistants, nurses also, but essentially set up teams that can go in, including even virtual models, to then debrief after these stressful incidences. I know that was very quick. We have a lot of aims to this grant. But in conclusion, this HRSA grant is brought to you by the team. It's not my grant. We have 20 plus people with a lot of experience on wellness. We're trying to do the whole continuum from nursing students to practicing nurses to nurses to prevent them from having issues related to mental health, but also to hit the parts when things go wrong, those critical incidences that happen and how we can help those in time of crisis. And with that, I will take any questions.
Alyson, this work is fabulous. So kudos, a big dose of vitamin G to all of you for doing this. I have one comment and one question. We use our nurse practitioner students in our college at Ohio State to actually do a wellness onboarding program for all of our health sciences students. I don't think schools and colleges of nursing have leveraged their students enough to improve population health and well-being at their universities. And this is an excellent model to implement. It really is. Secondly, how does psychological first aid differ from mental health first aid? At Ohio State, I got about 14 people trained in mental health first aid. And they go out to every nook and cranny of the university to do that workshop. I'm just curious about how these two programs differ.
That's a great question, and I will do my best to answer it. The psychological first aid is definitely focused more on the layperson, so less on the actual healthcare providers. It is more broad. If I was to understand mental health first aid, it would be more fixated on the mental health aspects of it. The psychological first aid is at the moments of crisis and what you do and what you get them to the resources they need. And that's a very brief encounter. I would guess that there was some overlap to it, but it does feel like, and actually our wellness officer at UNMC said this the other day, that there isn't a psychological first aid actually targeted to health professions. So we do assume we get this training in school, that we know how to handle at the time of crisis, but the programs right now aren't geared directly towards those practicing in the healthcare fields. So if I was to guess, there's overlap between psychological first aid and mental health first aid, but psychological first aid is more broad. It can be given to general audiences. And I think that identifying people in times of crisis, even beyond just the healthcare providers, is crucial to helping combat some of these mental health issues. So in short, I think there's overlap, but they're a little bit different.
Yeah, mental health first aid can be for lay people too, okay. But I am going to check out psychological first aid just to see.
Please do. They have a fabulous course on it for free that they offer through Coursera, but it really is a great course.
That's great. And mental health first aid is not free to be trained on. So that's one big differentiator.
That is a big differentiator, definitely. And we've talked about actually developing maybe a combination of those two, focused on those who are healthcare professionals, not necessarily behavioral health professionals, because they get a lot of that training in their programs, but in general, more broad.
That's great. Amanda is asking, what's one of your favorite interventions within the program?
Oh, that's fun. And for the wellness program, one of the things that they had in there that I thought was, I'm going to get myself out on this. I love HGTV and organizing. And one of them was how to organize your physical space and your mental space. And we have pictures and some research attached to it of how people function and how their mental health and optimism and outlooks look when not only their physical space is organized, but their mental space is organized. So tips like that for students and showing them pictures and promoting research related to the areas. I think that's fun. Also humor. We have a lot of people on our grant who like to appropriately use humor for some situations. And I think particularly in nursing, that's an area that's sometimes used. So those two, I think I like the best.
That's great. Well, Alyson, thanks so much. We really appreciate your presentation today. Everybody, join us for our last webinar for the academic year. Sue Salmon from Rutgers will be presenting stress first aid next Wednesday. In the interim, stay well. Glad you could join us.
Thank you.